Hi guys, it's me, Professor Dia. Welcome back to my YouTube channel. I'm on a roll. This is my second Kahoot in one day. In this Kahoot, we're going to be going over assessment and mental health. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. So go ahead and give me a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. I've got so many resources there available for you. You can sign up for a next generation NCLEX tutoring review session. I have a part 1 and a part 2. Part 1 is where I teach you how to think like the test writer. I teach you different scenarios and phrases that you should be familiar with and what the test writer is trying to draw out of you. I go over critical thinking, priority, delegation. In part 2, I go over important concepts, question format that you need to know. Now, they're not going to be the exact questions you see on NCLEX. If I had a penny for every single time I had a student ask me, are these the questions I'm going to see on NCLEX, Professor D? No, I do not write these questions, okay? I do not see these questions. However, I have lots of students that love me. So they go take their boards, they pass, they come back and they say, Professor D, I saw this, I saw that, I saw this. And so guess what? I start to see a pattern. So I'm pretty familiar with the types of concepts that you're going to see. And so I say this to you guys all the time. I can take a rationale and create 1,000 questions out of that one rationale. That's why you should not try to memorize questions. You're wasting your time. What you need to do is understand the rationales. And that's what I go over with you. In part 2, we go over questions, but we dig into the rationales and the most important things that you need to know. So no matter how that question is flipped to you, you'll still be able to answer. If you're still in a nursing program, don't worry, I got something for you. Audio lessons, where I teach the most important things you need to know for your upcoming exam. So if you have a test coming up, you have not been doing well, or you really have to get a high grade, go ahead and check out my audio lessons and see if I have one that matches your upcoming exam, and thank me later. Last, I've mentioned this a couple times. It's in the woodwork, so just keep your eyes and ears open. I do have a Nexus nursing test bank that will be coming out soon, and it's going to be going over the most important things you need to know to prepare for NCLEX, the important concepts, and they will be question format. They are not the exact questions you're going to see on NCLEX. However, they're close, okay? It's enough that you understand what you need to know, how you need to answer those questions. So they're coming soon, and I'm going to be giving away some memberships once they're available. I'm just not sure how I'm going to format it, but keep your eyes and ears open. Without any further ado, because I don't think there's any more housekeeping I have for you. All right, guys, let's get started. Mental health assessment. Select all that applies. What observations should be noted during the mental status assessment? Select all that apply. So when you're doing a mental status assessment on a patient, what should you be noting? And here are your options: the gait and posture, the mode of dress, involuntary movements, affect, speech pattern, thought process. These are your options. Select all that apply. You are the nurse and you are performing a mental status assessment. What would you be noting in your documentation? What would you be looking for? What would you be paying attention to? All right. All of them. Every single one of them. The gait and the posture, what will that tell you? Well, the gait is how the person is walking. Are they walking in a straight line? Are they walking normally? Are they walking zigzag? Are they walking like they're drunk, like ataxia, right? Posture, are they sitting straight as if they're confident in themselves and their environment? Or are they stooped over? Mode of dress, you have an 82-year-old female patient, but she presents to the clinic in a thong bikini and heels. What does that tell you? Involuntary movements, you're performing the assessment and the patient's just tapping their foot. They can't even help it. Or they keep looking at the clock on the wall. Their affect, when you look at their face, can you tell that they're angry, that they're happy, that they're excited, that they're nervous? Speech pattern. Are they having conversation with you in a rapid speech? Matter of fact, their speech is so rapid, there's spittle coming out of their mouth. They're not even taking a breath in between words. Are they speaking very slowly, like here? What is the thought process? Are they able to have a conversation with you, or are they going from one thought to another, to another, to another, to another, to another? All of these are things that you should be noting during your mental status assessment. Here's another select all that applies. All right, which would be considered an abnormal assessment? And here are your options. Poor hygiene, slumped posture, slow gait, poor eye contact, pacing, restlessness. Which would be considered an abnormality within the mental health assessment? The code to get in is 854-4973. 854-4973. Okay, all of them, guys. All of these are abnormal. Poor hygiene. Why are you not bathing? Why are you not brushing your teeth? Are you depressed? What's going on? Slumped posture. Instead of sitting up straight, why are you slumped over like this? Slow gait. Why are you walking so slow? Poor eye contact. Why aren't you looking me in the eye when we speak? Pacing. Uh-oh. Let me tell you something. As a nurse, you see a patient pacing, you better be thinking about what? Safety. Okay? A patient's pacing, that lets you know that they're starting to be riled up, and you don't want them to punch you or another patient on the floor. You're going to be concerned about pacing. Restlessness. What does restlessness tell you? That tells you there's been a change in cognition. Why is the patient restless? Now, when we're talking about med surg, usually patients restless because there's decreased oxygen to the brain. When we're dealing with mental health, yes, it could be decreased oxygen to the brain, but there may be personality disorders, there may be other issues that we're dealing with. But guess what? Restlessness, where that patient can't even stay still, that is not a normal assessment. Which is not considered to be a normal cognitive finding. Which is not considered to be a normal cognitive finding. Here are the options: demonstration of orientation, person, place, and time, ability to correctly repeat a series of one or two numbers, ability to make decisions based on sound reasoning, demonstration of realistic awareness of self. Which is not considered to be a normal cognitive finding. I'm so proud of you guys. The few who answered, there's over 100 people in this room, really. But the few of you that answered, that were brave enough to answer, very good. The ability to correctly repeat a series of one or two numbers, what is that? We want them to at least be able to repeat what, 5 or 6 numbers, 1 or 2, that's not enough. But all of the others are normal. Being able to demonstrate orientation to person, place, and time, great. Being able to make decisions based on sound reasoning, you're using logic, wonderful. Demonstrating a realistic awareness of self. Because if I look at you in the eye and I tell you that I am skinny, guess what? I do not have a realistic awareness of self. But if I tell you I'm intelligent, I do, right? So all of those are normal findings, but not being able to correctly repeat a series of 1 or 2. No, we want them to be able to correctly repeat a series of 5 or 6. Okay? All right. What is it called when the patient involuntarily repeats words spoken by the nurse or someone else. And I'm even going to give you a clue. The word starts with an E. So if you say something and the patient, they can't help themselves, they'll repeat that word, or anyone else who's around them, they hear someone else say something, they'll just repeat it. They can't help themselves. What is that called? Very good. I see you guys on the live. Don't be lazy, BSN student. What's the whole word? Type in your answers, guys. If you're in the Kahoot with me, type in your answer. What is that word? When the patient involuntarily repeats words spoken by the nurse or someone else. All right, very good. Echolalia. I don't know. Echolalia, that is the word. 34 of you guys got that correct. Good job. All right. What type of communication constitutes 2/3 of all communication? And it's the most accurate reflection of attitude. What type of communication are we talking about? Type your answer in. What type of communication constitutes 2/3 of all communication and it's the most accurate reflection of attitude? Jennifer, you're close, but there's a name for it. I'll give you a hint. It starts with an N. N as in Nancy. Body language, echolalia, I don't know. Therapeutic. Nonverbal. Nonverbal communication tells you more than verbal communication because that patient will tell you, I'm fine, and they're crying. I'm fine. And you look at their affect, and it's very clear that they're upset. Their arms are crossed. They're standing away from you. The legs are crossed. Nonverbal communication. That constitutes 2/3 of all communication, and it gives you an idea of that patient's attitude. Which is not one of the phases of a therapeutic relationship. Which is not one of the phases of a therapeutic relationship. Here are the options: the initiating phase, the working phase, the discovery phase, the terminating phase. Very good. Discovery phase. I made that up. No such thing. So we have the initiating phase. This is the very beginning where you introduce yourself, the patient's introducing themselves, and what's happening? Boundaries are being created and established, right? And then you have the working phase where you're actually working through the problem. And then the terminating phase. This is when everything, all of the work that has been done gets summarized and that patient's getting ready for discharge. Okay, make sure you know those phases in detail. Which therapeutic technique allows the patient time to think and reflect and also conveys acceptance? Would it be broad openings? Would it be silence? Would it be clarification? Or would it be reflection? Which therapeutic technique allows the patient time to think and reflect and it also conveys acceptance? Okay. I'm happy most of you guys got the correct answer. Let's talk about this. It's silence. Silence is a form of therapeutic communication. So you ask the patient a question or you make an observation and then you shut your mouth. Be quiet. Give them time to think about what you just said and formulate thoughts or ideas and express themselves. Okay. How are you conveying acceptance with silence? Well, if you're there and the patient's upset and they don't want to talk and you don't talk, you just sit there right there next to them and you're quiet. You're letting the patient know that they're important to you. We don't even have to talk, and I'm still going to be right here, right? You're conveying acceptance. Now, there is a time that same silence that I just told you is therapeutic, there is a time that silence is non-therapeutic. You want to know when that is? Matter of fact, before I tell you, those who've been watching me for quite some time, tell me in the comment section, when is silence not therapeutic? Oh, you guys are a hot mess tonight. Okay, so silence is not therapeutic if the patient's putting themselves down. If the patient says, I'm so dumb, I'm so ugly, I'm not worthy, nobody loves me, and you don't say one word, you're just like, What are you saying to that patient? What are you conveying to them? You're conveying that, yeah, they're right. They are ugly. They are dumb. Nobody loves them. They're worthless. Right. So when a patient is putting themselves down, if you're silent, then guess what? It's not therapeutic communication anymore. It's not therapeutic. It's non-therapeutic. So if the patient is putting themselves down, you need to say something. You may want to ask an open-ended question. You may want to clarify. You may do lots of other things, but what you're not going to do is be quiet in that situation. Okay. When you're silent, you're agreeing. All right. Broad openings. That's when you allow that patient to express themselves. You're asking an open-ended question. You're saying something like, tell me about what brings you here today. It's not something where they can just say yes, no. They have to actually explain or describe. Okay. Now, clarification. This is when a patient says something and then you zoom in on that. You ask for clarification. You ask for details on something that they already said. You need further explanation. And then reflection. That's when you're basically paraphrasing. You want that patient to know that you hear them. You hear them and you understand them. And you want to confirm that what they're saying to you, what you're understanding is exactly what they're trying to say to you. So you paraphrase what they just said to confirm understanding. Select all that applies. Which type of communication should be avoided? What type of communication do we stay away from? Here are the choices: closed-ended, judgmental, arguing, advice, or giving advice, I should say, reassuring, asking why. Hmm. Oh my goodness. I'm so sorry, guys. I don't know what I was thinking because reassuring and asking why should also be checked as well. Forgive me. I'm so sorry. These, everything, it should be all of them. So I'm so sorry for the people who chose reassuring and asking why and don't get credit for it, because every single one on here should be avoided. Let's start with closed-ended questions. You don't want to ask closed-ended questions. You want to ask open-ended questions. You want patients to be able to describe things. Now, there is an exception to this rule. There are situations where you want to ask closed-ended questions. What are those situations? One, abuse. If you suspect that patient is being abused by someone, you ask them directly, not is your husband abusing you? Is your boyfriend abusing you? Is that person that just brought you in, are they abusing you? No, you cannot accuse them because remember, even though they're being abused by that person, they still have a sense of loyalty. You ask them if anyone, you leave it open so that way they don't feel like they're betraying that person. If anyone is harming them, you ask them directly, abuse. The second situation is suicide. Studies have shown most people who are suicidal, um, they want help. No one's ever asked them directly because this is a sensitive topic, so most people like to beat around the bush. You as a nurse, you do not. You ask them directly, are you having thoughts of harming yourself? Directly, yes or no. Is anyone abusing you? Yes or no. Are you having thoughts of harming yourself? Yes or no. What is the third situation that you're going to ask closed-ended questions? That closed-ended questions are okay. The third situation, what is the third situation? Hold on, let me think about it. Oh, yes. The third situation is assessment. So it's an emergency. You have to do a quick assessment. Your patient has a rupture, is suspected to have a ruptured appendix or ruptured bowel, or maybe they got into an MVA. We don't know, but they have to get to the OR immediately. As you're rushing that patient to the OR, there are things you need to know right now to save their life. Have you had any alcohol within the past 24 to 48 hours? Yes or no? I don't have time for a long dissertation. Are you on any blood thinners? Yes or no? I don't have time for any dissertations. Do you understand what I'm saying? So a quick assessment. Those three are reasons you'd ask closed-ended questions. Other than that, generally speaking, you want to ask open-ended questions. You never want to be judgmental. In nursing, you are in a position of power. You're caring for that patient, right? If you have a judgmental attitude, there may be some important information that the healthcare staff need to know, but they're not going to tell you because you're being judgmental. Arguing. You do not get into power wars with the patient. You don't argue. You don't give advice. You never say, if I were you, absolutely not. Reassuring. Reassuring is saying things like, oh, things will get better. Don't worry, everything's going to be okay. How do you know everything's going to be okay? You don't know if that patient's going to bleed out on that surgical table and never come back, right? So we don't give reassuring, false reassurance. We don't do that. And of course, why? We never say to a patient, why did you? Because the minute you say why, you're putting them on the defense. They're going to shut down. They're not going to share information with you. You never say why, and you never say what made you. The minute you say to a patient, what made you do that? You gave them an out. You know what they're going to say? Oh, the voices in my head. It wasn't my fault. I didn't do it. The voices told me to do it. You don't do that. You never say why, and you never say what made you. How are you guys doing? Yes. Why is like blaming? Absolutely. All right. What type of question is, do you live in the city? Is it an open-ended question? Is it a closed-ended question? Is it a reassuring form of therapeutic communication, or is it judgmental? And everyone should get this right because I just went over these types. Very good. That's closed-ended. Whenever they have to say yes or no to a question, that is a closed-ended question. Instead of saying, do you live in the city? Guess what? What you consider to be the city may be something else to that patient. So instead of saying, do you live in the city? You ask that patient, where do you live? Or what city do you live in? All right. True or false? Don't worry. The same thing happened to me, XYZ, is a form of therapeutic communication. Is that true or is that false? Saying to the patient, don't worry, the same thing happened to me, XYZ. That is a form of therapeutic communication. True or false? False. Number one, you said don't worry. You don't ever tell a patient not to worry. What if they have a good reason to worry? You never say don't worry to a patient. Okay. And when you say don't worry to a patient, you are minimizing their emotions. You don't tell them not to worry. And number two, same thing happened to me. Guess what? Nursing is not about me. It's about you, the patient. You never say me or I. When you do that, you're making it about you're centering yourself when you need to be centering the patient. Okay. All right, guys, two more to go. According to Maslow's, which is not a physical need? And there's only one answer here. According to Maslow's, which is not a physical need? Here are your choices: oxygen, food, water, sleep, sex, security. I'm proud of you guys on the live. I thought I was going to stump you. Wow. I did not stump them on the live, but I stumped you guys on the Kahoot. 35 of you said sex. Sex is a physical need. Oxygen, food, water, sleep, sex. That's a physical need. Security, you want to know what type of need that is? That's safety. That's safety. Um, that's making sure the patient's safe. So an example would be order versus chaos, right? That patient's environment is full of clutter. That's a safety issue. They can harm themselves. But who cares about patients' safety needs if the physiological needs have not been addressed first? But very good. You guys on the live? Very good. Last question. This is a drag and drop. Put this in order. Prioritize. Prioritize sex, oxygen, food, fluids. By the way, these four all fall under physiological needs, okay? But yes, they fall under physiological needs, but within them falling under physiological needs, how are you going to prioritize them? What's most important versus second important, third important, fourth important for your patient? What comes first, second, third, fourth? How would you prioritize these needs for your patient? Okay, very good. One thing I think we can all agree on, everyone had sexes last. Good job. What I noticed, everyone also had oxygen first. Good job. But I noticed between fluids and food, a lot of you guys have them the other way around. Let's talk about this. Whenever you're asked to prioritize something, you have to think to yourself, what will keep my patient alive the longest or kill them the fastest? That's going to be my priority. So let's talk about this between fluids and foods, because about half of you guys chose food first. Okay. So let me ask you something. What is going to kill you the fastest or keep you alive the longest? Going without food or going out without fluids? Or getting food or getting fluids? Which one? Fluids. You can survive weeks without food, but only days without fluids and electrolytes that are found in the fluids. So by far, Fluids is going to be the priority. If you have to choose between fluids and food, you're going to choose fluids, because without those fluids, guess what? Your organs start to shut down. It takes weeks for that to happen without food, but only days without fluids. So whenever you're asked to prioritize something, that's how I want you to think about it to get the answer correctly. Look at your options and say to yourself, which one's going to kill my patient the fastest or keep them alive the longest? All right, let's see how you guys did.